We have been in contact with so many patients that, although many have said they've done a lot of reading, have done a lot of web searches on Google, or have had information from families or friends, or have attended some sort of childbirth class, when they've presented to the floor, they still seem to either have a lot of misinformation
because of all the information that's out there, or people telling new parents or expectant parents, oh, this happened, this happened, this happened. This is not going to be your labor story. You create your story when your labor happens. It's your baby coming through your body with the powers of your contractions, and therefore it's individualized. And so
often, people go through life-changing experiences without any guidance. But what if you had the tools available to help you in your journey? I welcome you to the Misguided Notions podcast. Our mission is to create a space where we discuss thought-provoking topics with people that go through real life experiences. My goal is to inspire, empower, and help build awareness to a number of issues that our society doesn't really talk about. So listen in, engage in conversation, and if you'd like, share your story. That clip you just heard are from two guests, Antionette and Helen from Fledgling Families. They co-created Fledgling Families along with a group of other healthcare professionals in order to provide childbirth education for expectant parents. I find that a lot of women go through many different aspects of maternal health related issues that they don't really address, and I feel that it's because of our society. Perhaps we don't really enforce discussions related to certain things. I mean, for example, it just seems to me a woman has a baby, or they may have had issues throughout their pregnancy and things like that, but there seems to be this business as usual mentality. Like, despite all that you went through, life goes on. And I had questions about things like miscarriages, postpartum depression, having mental illness, and having to be pregnant. I just had all these questions. So I thought, why not have these two women, Antionette and Helen, who have years and years of experience with regard to labor and delivery and just overall maternal health. And I thought they offered a lot of value and a lot of great insight. I broke this interview into two parts. So this is part one of maternal health and wellness with Antionette and Helen. We are here with two very special guests from an organization called Fledgling Families, Helen and Antionette. Please introduce yourselves. Antionette, tell us about yourself.
Hi, my name is Antoinette Grant, aka Tony. I am a labor and delivery nurse by, I guess, specialty. High risk. I've been a nurse for 25 years in maternal child health. Have done a little of everything, from management to a little pediatric ICU, to the passion, which is labor and delivery. That's me in a nutshell.
Okay, and Helen?
what a wonderful nutshell. And my name is Helen O'Keefe. I trained as a midwife in England and then worked for about 2 years after I completed my training. And that was pretty much all in the normal. And I then came to New York and started working in a labor and delivery unit here in 1990. And because I like to know the people I work with, I'm still in the same labor and delivery unit, giving care on a daily basis to people who are having normal deliveries and people with a lot of medical issues who are having their babies. And I, like Tony, love labor and delivery. And that is me.
Okay, very good. So, what was the inspiration for your organization? And what, mm, well, not just the inspiration for it, but how can expectant, I feel like it's a two-part question, but how can expectant parents benefit from an organization like yours?
Okay.
But tell us about it first, I guess.
Okay, so Fledgling Families is we are a childbirth education service. There is 4 of us in our practice. We are all labor and delivery nurse trained. With the 4 of us, we have more than, don't judge us, over 100 years of experience. With the junior person having at least 15 years. So that tells you how much experience we have. And, I think really our dream came to fruition really because we have been in contact with so many patients that although many have said they've done a lot of reading, have done a lot of web searches on Google, or have had information from families or friends, or attended some sort of childbirth class. When they've presented to the floor, they still seem to either have a lot of misinformation or I don't want to say they were misguided to some point, but there was a lot of anxiety, which yes is normal to a degree because, that big day, when you still present, it's like, oh my God, this is really happening. But there was still a lack. Definitely, there was still a lack of, I think, education or preparation for them. And, I think we brainstormed and we just said, Helen had already been doing some childbirth education on her own. And we, kind of just came together and said, let's do this. Who better than to really put our population at ease? And who better to educate than us? We do it, we live it, we breathe it on a daily basis. I think the clinicians that we work with, they trust us, they trust our judgment, and we felt that we can deliver this same education in a nice, calming manner. And that's part of our philosophy and our mission with ease, and to make sure we do it in a fun manner that patients can really feel that when they walk out, that they can know what they're preparing for and what to expect when they arrive to a labor floor. And you don't need to just be delivering at our hospital, but pretty much at any hospital, because we do have clients that come to us that may be delivering at a different hospital than ours. But also, if you do deliver at our hospital, that you may see one of the friendly faces from one of us when you attend our class, we might be there. And so we'd love to be able to continue or have that continuity of care with you when you come to the labor floor.
Okay.
Does that leave me with anything to say?
I think so.
I always have something to say. I'm known for this. So we created a syllabus that we felt would encompass pretty much everything that people would need to know on the norm from when they start to come to see us, and we recommend anything from 29 weeks to 33 weeks. That way it's early enough that we can address potential issues with prematurity or preterm contractions, moving onwards to the normal onset of labor, etc., and discuss pain relief, and then give further education with what to expect with your baby in the hospital. We like to think that we keep up to date. Most of us are certified in inpatient obstetrics, which just means that we continue to do continuing education to keep up to date with the new and improved knowledge that's coming out, all trying to ensure that we give the safest information to people. And our goal is not to fill them so full of knowledge that they are, overwhelmed. We give access to information that we use, and there is extra reading if somebody truly wants to read more. We've created videos on massage techniques that may be helpful, and these are fun. In fact, at classes we used to do it, but as the class size got bigger, we found that we couldn't do the individualized teaching of every unit, the couples that were coming. So we couldn't show the individual, but we created a video and believe that this can be helpful going forward with regard to pain relief. And then we found that people had questions, and if we were limiting class size so that there was an element of intimacy involved, so that people felt their questions were being answered. So we kind of thought if there are 5 couples or more, 2 people would give the class, so that we would be able to give the questions the time that was required, just so that people would leave feeling more informed and less scared. And that is the goal.
And still meeting our needs of attention, providing great attention.
Absolutely. That's what Tony says.
And I have a question for you with all that you said. So what sets you apart from a doctor's office? Now, I know how I would answer that because I come from the healthcare field. But for our listeners that may not be aware of the huge differences, can you talk about what sets you apart?
Well, as much as our doctors like to, and I think would like to spend more time with their patients, unfortunately, they are limited in their time just because of DRGs. They are allotted a certain amount of time.
Mean?
Yes, well, what's DRG, Tony?
well, they are allotted a certain amount of time to spend with each patient, a certain amount for an established patient, which is usually like 15 to 20 minutes per patient. A new patient, they may be allotted like 30 minutes, Yes, you can call in if there is an issue, like if they're on call and whichever doctor calls in, you can call in, the service will, deliver that message and they'll call you back. But for us, we're that additional resource. You could think of us as for the doctors, with the doctors. We work hand in hand with them. And so these practices that we work closely with basically entrust us with their patients as well, because they see our syllabus. They see and they know how we work as we work with them hand in hand on a regular basis. So they know the type of care that we deliver as well as the information that we're providing. Mm-hmm. So we're able to work with them on a one-on-one basis, mm-hmm. right? So we can spend a little bit more time, whereas their physicians aren't. So when we provide this education, now they may be able to take notes and streamline questions that they may still have for their doctors. So when they go to their visits, they can pick the most important things that they really want to focus on with their doctor. Mm-hmm. And their doctor can potentially now have that time to really answer what is most important to them that they haven't, or that they didn't think that they had that time to do before.
That makes a lot of sense.
Yeah.
I think that's very valuable and a resource that people don't realize is available. Right. And the fact that you're kind of a go-between or right. the negotiator, I don't know, maybe that's too big of a word, but you know what I mean? Like you're the navigator.
Facilitate.
Yeah, facilitate. That's the word. Yes. Yeah. Okay.
And I think it takes some pressure off of the physicians because they're trying to do their best by their patients as well.
Of course.
But once again, there's so much time in a day where they have to see X amount of patients. Right. And to be able to, once again, have that full amount of time to provide that same for each and every patient, sure. it's pretty difficult, Mm-hmm. And like Helen was saying, it's great that some of the services that we are able to provide or some of the classes that we provide, besides our essential childcare class, we do prenatal lactation, we do infant-child CPR, we do newborn care class, we do special circumstances, like if a mother or a couple knows that they may not be delivering by a vaginal delivery or can labor, and they are going to be scheduled for a C-section. We do like the C-section prep class. Mm-hmm. So, we have many options and, hope to be growing even more. Mm-hmm. So many options available.
Helen, do you have anything to add?
Well, we just hope that, because of all the information that's out there or people telling new parents or expectant parents oh, this happened, this happened, this
Mhm.
happened. This is not going to be your labor story. You create your story when your labor happens. It's your baby coming through your body with the powers of your contractions, and therefore it's individualized. And so our goal is to say, try not to pigeonhole yourself, take off the blinkers, and know that you just take things one step at a time. And after our class, which is quite a long class, and we do agree and we warn people, don't go anywhere near the literature, don't look and see, don't look at the information. We say the only one that you should look at is if you're going to deliver in our hospital, is that they do a tour of the hospital, which is online. And we also say you can look at the video of massage techniques if that's what you wish to do, but nothing that's involved with knowledge, solidification.
Right.
Nothing.
Right.
It's too much.
Right. That's like you let's say I Google something
Yeah.
with regard to my health. A list of things come on, and I'm just like, oh my God,
It
I'm going to
increases
die.
your anxiety.
You know?
Yes.
I mean, yeah, I get
And
it.
that's the idea of coming to the classes.
Sure.
We're actually the translators from the books to reality to the individual.
Hmm.
I like that.
I like that too. I just came up with that. High five.
I do too. You better write that one down.
That's a good one.
Another thing that I wanted to talk about, recently some women have been open about discussing miscarriages. Most recently, Michelle Obama on her current tour that she has going, and also in her book, which I haven't read yet, but I have it, and I saw you have the book. But what do you think we as a society can do to create a safe space for women to openly talk about their experiences with regard to issues like this? Or their fears even?
Would you like to go first?
Well,
let's stick with the routine.
Oh my goodness, you're so kind. Well, I definitely think just as women, we need to be supportive of one another, regardless of course, skin color, socioeconomic makeup, like postpartum depression, which is another, hot topic. There should be no barriers. There's no taboo, and, we need to, it's healthy to discuss and to talk about that hurt because it's a part of you. So we need to have these support groups. I think if you feel like you can't speak to your doctor, I'm hoping that doctors are really having good conversation with our moms or our patients once they have these losses. And I think working at the institutions that I've been at, when there are losses, and we call them bereavements, there is so many resources. And the social workers, the staff involved, do a really good job of making sure that parents, because it's the couple, it's not just the mom,
right,
but it is the couple, that they know that they haven't done anything wrong. It's not their fault, because that is the number one thing that moms have to understand, that they didn't do anything wrong. Sometimes it's just the makeup of the pregnancy that, the body, unfortunately, it's resilient, and it's what it's doing is it's rejecting, for whatever reason, this pregnancy. But she needs to understand that. And although that pain at the moment is not going to go away, and to say, you can try again. Yes, she may know that, what we need to instill that, but, getting her through this first part is really important. So it's really just making sure both of them know that there are resources for both of them, because there are also resources for dad. Because there are support groups for the husbands or the dads, that they can speak on their feelings, because they may not know how do I support my significant other through this tough time. And it could have been, whether it's their first, their third, it's a loss is a loss, and they may be thinking, how are they able to cope and if they have kids at home, then how do they explain to the siblings that, because it depends on the gestational age, that, this new addition is no longer going to be coming home. So there's so many different facets to this,
Sure.
so it's big, but it's allowing them to talk. It's allowing to know that we have resources available to them to be able to express their feelings, their thoughts, and just being there, I think, for them.
Thank you. Well, I read up a little bit about this because we work more with the further advanced labor
Right, sure.
or pregnancies.
Yeah.
However, we do take care of people on our labor floor who are 16 weeks and above, who are losing pregnancies. And it's all of those hopes and dreams. And so we choose deliberately to look after these people on our labor floor because we feel that the bereavement effect is starting to be used at that stage. I personally take care of a lot of people who are going through loss. I think it's very important when somebody is taking care of somebody having a loss that they're not afraid to express their own emotions. We've all dealt with loss in whatever form.
Sure.
The loss of a pet when you're a child, family members that you no longer have around. And if you feel like you can't be empathetic or you can't show your emotions, then really that's not the place for you to be at that time. The problem with miscarriage is it's so common. It's 1 in 4 people that lose a baby before the end of that first the first trimester, and that's really because of chemically that the placenta doesn't really take over the work that it should do, and so that initial nutrient for that developing zygote is no longer there. So it's a lot of pregnancies that are lost.
Sure.
And possibly because it's so early and a lot of people don't even know. It's not a known thing. You may just barely have gotten missed a period or two. You may have gotten that pregnancy test. The thing for women is they're very, very, they see that positive pregnancy test, especially when they've been trying to get pregnant, and the attachment is formed.
Of course.
And it should be, and is, because that's the nurturing nature of the mom. Guys are a little more concrete in their thinking. It does not mean that they're not as thrilled and excited. And you look at any of the YouTubes there when moms are giving this knowledge to their dads that or partners that they have got a pregnancy on the way, and the excitement is palpable. However, sometimes it's the seeing of an ultrasound. It's the seeing of the movement of the limbs in the abdomen. But even in the second trimester, it's 5% risk of miscarriage.
Wow.
That's still quite a large number of pregnancies.
Yeah.
And it doesn't really matter when. People don't know how to react, so they may use those words, the baby wasn't born yet, you didn't get to hold the baby, you can try again. And yes, technically within 6 months trying again, physically you can probably get pregnant very quickly and be at a better chance of having a pregnancy that goes on to a healthy pregnancy and the delivery of a lovely healthy baby. But emotionally, are you in that same place?
Right.
And so it's that, and really, it's that declaring of loss. You're grieving. You're in denial. You're angry. You're bargaining. All those. It takes a long time to get to acceptance, and depression is sometimes on that way as well.
Sure.
We at the hospital we work at. and I'm not going to promote one hospital ahead
Mhm.
of any other hospital.
Mhm.
But we do have a bereavement ceremony once a year, which usually happens at the end of October, beginning of November. So we're coming into that winter months. We're coming into those more religious times of All Saints, All Souls, etc. But we have a multi-denominational service whereby we give flowers to people. They're encouraged to read poetry they've written. We have music. It's not the most solemn, but yet it gives people a place to go to grieve on that day, and knowing for people that they're going to have triggers like family members having birthday parties. Do you really want to go to a family member's house around the time when there's a baby shower? It takes a long while before people know what to do there. And whether you've, in my culture, in Irish culture, we do not buy stuff until the end. We're very, very superstitious. But in a lot of different cultures, and maybe, these having showers, etc., people get a lot of gifts, and there's a lot of stuff prepared and ready for that baby. And until you're ready, you don't know what you want to do, and people shouldn't try to make up your mind what you need to do with that.
That's a very good point.
With that stuff that you have, and whether you need to keep it someplace safe for another time, or hold on to it for a later date, or hand it over to somebody else, donate it.
Right.
That is your choice, and it's the right choice for you.
And it's an individual's decision. That's it.
But people should never feel like they have to be isolated and alone with this information, because with those numbers of 1 in 4, if you're sitting at a table with 4 women, one of those women has had a miscarriage, maybe more than one. And the table next to you, same. So why put it under the rug?
Right.
People need support.
Sure, absolutely. That's why I think it's great that women have been vocalizing it more. I think it's very important. Which also brings me to my next question, because we talked about a little bit, Antionette, you brought up postpartum depression. And I feel like now I hear more of it, and I know with my experience, I have dealt with new moms that are going through postpartum depression. But what are some signs and symptoms that loved ones, like partners, friends, family members, can look out for as far as possible indicators?
I think that's a great question. One of the things, which is good, what we also discuss once again, I think within our society, this is one of those questions that's like taboo. No one really wants to address it. And one of the things that we talk about in our class, even if it's just so that dads are aware, I like to say to them, when you get to go to an appointment with mom, make it a point to take her doctor's card. Why? Because you're mom's best friend. You know her best, right? So when you see that she's not engaging, with yourself or the baby. Now, baby blues, completely normal, right? So, there's a level of hormonal shifts with pregnancy. After pregnancy, your hormones are going to start to shift and decrease one over the other with the progesterone, estrogen. But there's a significant change with postpartum depression, right? So mom really is withdrawn. She can be withdrawn. Once again, not engaging, maybe not engaging with the baby, sleeping a lot, not eating, crying a lot. And you say, like, why are you crying? And she's like, I don't know, these are like indicators that something is not right. And that's when I say to them, you take up that card and you call the doctor. You let them know what you are seeing, okay? Because usually they should be saying, okay, you need to bring her into the office, right? A lot of times they would draw some levels, bloods to see what her levels are like. And hopefully they're going to refer you to maybe a psychologist to start, talking. They'll probably start the conversation, but they should also be referring hopefully to a psychologist because we know that there can be some levels of that depression when moms may start, talking.
Right.
You can get some information, and that specialist with postpartum, because they have some doctors who definitely specialize in postpartum depression. There can be severe cases where we've actually had postpartum psychosis. So it's very important to be cognizant or to be in tune with one's personalities or just how they are afterwards. We also tell patients, it's okay to feel overwhelmed as a new mom or dad, because this is all new, whether it's your first baby, whether it's your third, whether it's your fifth,
It's new.
It's still new, right?
Yeah.
And because you're responsible for one baby, you may be responsible now for your third baby. It's like if it's getting to you or that cry, put the baby down, close the door for a moment, phone a friend. Like we just used to say, phone a friend.
Oh, yeah.
Because, you might just be feeling like you're having a breaking point. Really important, to kind of just recognize certain things and act on it.
Helen.
Thank you. So I was actually, again, surprised by the numbers. So 1 in 10 will develop.
Wow, really?
Will develop a longer lasting depression that goes beyond that first 2 weeks, which is baby blues. That should be totally self-limiting, and that's the normal dysphoria with lack of sleep, and that kind of relates to 3 million Americans annually that suffer from postnatal or postpartum depression. So that feeling, as Tony said, about hopelessness, sadness, and thinking that everybody else can do better for your baby than you can, and that you're almost transfixed and say, my baby's crying, do I get out of bed to change that? They'll have the energy to do that. I don't really feel like I want to eat. I can hardly even wash myself. And no, those are very abnormal signs. And so you may have lost the realization yourself, but those around you surely haven't. They may be struggling as well with the lack of sleep and having a new baby. But although when you come home initially, it's kind of prudent to take the phone off the hook a bit and reduce the number of hours when you're going to have an open door policy to maybe 1.5 hours, so that you get the opportunity to sleep when your baby's sleeping, which, people can't emphasize enough. And on following up with people we've given classes to, they said, if only we could have, which is why we try to reiterate with people, give yourselves that period of time, 1-2 weeks, where you literally take the phone off the hook unless you're reaching out to people.
Right.
And then maybe having an hour to an hour and a half when you say, okay, call me at this time. Usually the baby already is waking up. The most important thing is to ask for help. Don't isolate yourself, ask for help, and be realistic about your expectations about having a new baby. Everybody thinks, oh, it's the most wonderful time of your life. How could you be anything other than happy? This is possibly the hardest job you're ever going to do. And that these babies, they just don't come with any bookbinder,
right,
and a Google account. They literally, and what's right 1 minute is not right the next. Just be reassured that sometimes it's that person who has those unrealistic expectations. In other words, you think the baby needs far more than the baby does, and you try to achieve it all. You're placing failure in front of yourself, and therefore being overwhelmed by feelings of guilt that are totally unnecessary. But depression in itself is an illness. It's a chemical thing. It needs help. If you were a diabetic, you would take insulin, and therefore you have got to realize that if you need medication to save your life at that time and to allow you to get back to being able to feel that this is your baby and I can be happy about it, and to be able to look after your baby again, because you're now able to look after yourself again, then please never hesitate. It's would be potentially self-limiting. However, in severe depression, people can hurt themselves and they can hurt the baby, and it's just not worth it. I think you have to know, and those around you have to realize that you're not yourself, and that it's important to reach out for help, and that it's nothing to do with what you've done. You've got to reach out for help. You've not got to take guilt on board, and you've got to treat yourself carefully. And then involving potentially the ability to exercise, get out in the fresh air, walk when you're able to, have somebody with you, go walking, bring your baby out walking with you, allow other people to kind of, occasionally you can express breast milk, etc. Even if you're on medications, it's still safe to give your baby nutrition. Your doctors aren't going to prescribe something that is going to be contraindicated. Now, obviously, we all think take nothing, but mom's safety and baby's safety, if you have a happier, healthier mom, whether she be taking medication to bring her level of mood to a state where she can look after herself and her baby, it's so important that you do that.
Sure, they go hand in hand.
Absolutely. And there's massage, acupressure, acupuncture, yoga. Give yourself some time for you. It's very important.
Absolutely.
Most of all, just remember, there's nothing to be ashamed about.
You just listened to part 1 of Maternal Health and Wellness with Antionette Grant and Helen O'Keefe. Stay tuned for part 2 of our conversation, where we go even deeper with regard to postpartum depression and why it's important for loved ones, whether it's a partner, friend, or family, that notices some of the signs. And also some tips on how to help expectant parents who may need support. Whether you are a new or an expectant parent, know that organizations such as Fledgling Families could be very helpful for you and your partner. So talk with your doctor, find out if they have some sort of partnership with an organization that provides childbirth education. Thank you so much for listening. Be sure to subscribe, rate, review, and tell a friend about the Misguided Notions podcast.